Hi, me again. I thought after doing the more younger generations, maybe we should be looking as well, or we can do when we get a little bit older. Now, let's again share the screen so you can see what's happened to the face when we age. We do have obviously different things we need to look at. It's not just the surface of the skin where we lost elasticity and hydration and we get fine lines and wrinkles. We do also have some volume loss. So that means we have lost some of the fat pads on the face. So we're getting a little bit more gaunted, or the shape of the face is start changing because these fat pads have gone. Also, we need to be thinking of bony remodeling. So with the aging process, unfortunately, we do lose bone as well. And some of the areas that suffer the most are the lower face. So the part of the chin, the part of the jawline, and around the mouth area. So normally what we call the marionette, so this area around here seems to be the one it obviously suffers the most. However, from earlier on is the mid face. So we getting that gravity effect again, so losing mid face as we can see on that image, and then going lower, and all those different changes can impact on how can we work on the face. So looking again here, we are going to be needing a little bit of this, what we call a rejuvenation, so a little bit more volumizing in the key areas. Now, when we talk about volume, doesn't mean your face look bigger. It means about lifting and repositioning the tissue to create a natural result. So looking at this picture, we need to get that lifting using the right fillers. So it's very important that your physician knows what fillers to use in which areas to actually improve how the face looks, rather than obviously make it exaggerated. And I just wanted to show you here very simple sample where we can see that this lady just simply looks more refreshed, but we haven't really changed how she looks. She just looks well. And that is the idea behind dermal fillers for a little bit more mature patients. I hope you enjoy, and I'll see you soon.